your Indiana congressional delegation, including Democratic Representative Andre Carson from the 7th District and Republican Representative Susan Brooks from the 5th District. Thank you both for being with us this evening.
Thank you.
Great to be here.
A few questions I want to get to right now. You know, we're watching event after event being canceled in Indy right now. Visit Indy reporting more than 80 conventions in Indiana have been called off. That's hundreds of millions of dollars, of course, in lost revenue. Should Congress do more to offset those losses? If so, what approach will you take? Representative Brooks, I'll start with you on that one.
Well, thank you for the question. Obviously, that is the heart of Indianapolis. We do an amazing job at hosting really large events. I think, though, that until we get a bit further the road with respect to whether it is the therapeutics, I don't want to say all the way until we have a vaccine, we're going to have to be incredibly careful how we open up large events. And if we can open up large events, so many large events around the globe have been canceled or postponed. And I do think this is a significant economic driver for Central Indiana. And I certainly know that the teams and the entities that oversee the facilities are very engaged in this. They employ a lot of people. We need to make sure that those people who work in those facilities, who get ready for all of those events, can be taken care of. And so I do think this is not just an Indianapolis problem. There are big communities all across the country that have this exact issue, and I think we will be looking at issues like that in the next package.
A lot to consider there indeed. Representative Carson, same question for you. Should Congress do more to offset those losses?
Well, we're working to do that right now. The Democratic caucus and leadership, we're negotiating with the Republicans and their leadership as well, and looking at CARES Point 2 or C5, however you want to dub it. But Congresswoman Brooks is right, my dear friend and colleague, about vaccinations and, of course, social distancing. But what we intend on doing with CARES 2.0 is looking at directing funding towards cities and states who have become cash-strapped as a result of this pandemic. And so I would like to see a clean bill, no attachments or no distractions, a clean bill that deals directly with cities and states. Something else that involves that would be broadband access, making sure we talk about vote by mail, and also making sure that businesses are supported in the process. So we need cities to address their lost revenue, of course, and we're pushing hard to do this in the bill by providing funding to these municipalities and states.
This one is a hot topic today. Simon Malls was planning to reopen locations in Indiana on Saturday, but today Indianapolis Mayor Joe Hogsett said malls cannot reopen in Marion County. We are still waiting to hear from other counties and, of course, the governor tomorrow. Robin writes this: I work at the Fashion Mall. I've talked with several fellow employees at other stores, and we are all scared to go back to work. So, Congressman Carson, to you, what is your message to all concerned workers who feel it may be too soon?
I think that that's a balancing act that many of us are struggling with. Employers are struggling with it. Employees are struggling with it. There's fear, but there's also a need to get back and bring back money for one's families, but also, the Simon family, they've been great Hoosiers. They're great community stakeholders. They're friends, and I appreciate what they're doing. So we're going to have to balance listening to employees' concerns while at the same time meeting the needs of our families who need income to come in to be stable. So we're seeing a transition of sorts, which is why it's so important that the CARES Act allowed funding to go to businesses. We saw disproportionality in terms of bigger businesses getting these funds, but that's why we extended the pay of the PPP, and we want to do more for those people who are anxious about losing revenue, but at the same time being safe from exposing themselves to this pandemic.
And Representative Brooks, your message to workers.
Well, I'm very proud that in the first round of CARES Act, we did come together in a bipartisan way, in a huge way for the country to provide relief through what's called the Paycheck Protection Program. It's hard to say. So Congressman Carson and I vote, it's the PPP. And we know that thousands and thousands upon Hoosier businesses, small businesses, were provided relief. And it's not the businesses, it's to bring back the paychecks for those employees, the employees of those businesses, to make sure those businesses can help pay their rent. It's not as if rent's not due, or to pay their mortgage payment, or to pay their utilities. So much of it is forgivable by the federal government. And so I think the Treasury and SBA have worked incredibly hard and incredibly fast to try to make sure that those who are employed by businesses can get their paychecks. I think that balancing act, and I completely agree with Congressman Carson, is so difficult for our business community, because we need to make sure that the employees are safe, and that they can feel as if procedures will be put in place, social distancing, maybe masks, maybe gloves. But we have to listen to our medical professionals, like Dr. Kane in Marion County, who is advising Mayor Hogsett. And if she says we're not quite ready because the numbers are still far too high in Marion County, then we may have to wait. But I think that we do have to get back to work. We have to do it safely. And I know people are ready. And so we've just got to figure out that balance. And that's what government officials and business owners are doing each and every day.
I want to stay with that topic of relief. And, round 2 of the Paycheck Protection Program gave some additional help to small businesses, like you both mentioned. Indianapolis Mayor Joe Hogsett and the Indy Chamber, they put out provisions to help minority and women-owned businesses. So did the Trump administration, setting aside specifically $60 billion for minority and rural businesses. Small businesses are asking now, how are you going to make sure they can get access to those available funds? And also, I want to ask both of you, how are you supporting our minority and rural businesses moving forward? Congressman Brooks, or I will start with you, Congresswoman Brooks.
Well, and I was really pleased to hear from the leader of the Indianapolis City Council, Vop Osili, reached out to me as we were going through this, trying to make sure that I was very familiar with the Indy Chamber of Commerce was doing, what the City Council was doing, and I commend them for doing that. So we have what are called community development finance institutions that help make sure there are funds of money that go, whether it's in opportunity zones or other areas, to ensure that our minority and women-owned businesses and other businesses have specific funding. And I was pleased to see that in CARES, we made that happen. Not just in Indianapolis, which I think has been a leader in promoting this, thanks to the Indy Chamber, Mike Huber, and all the others that came together, but also around the state. I think it's very important. We want to make sure those businesses survive when this is over, and we're here to provide that relief now to get them through this horrible time.
All right. And Congressman Carson, to you.
No, I agree with Congresswoman Brooks. I mean, Council President Vop Osili has been a great leader, as well as Mayor Hogsett and Governor Holcomb. In the CARES Act, over $60 billion went toward women and minority-owned businesses. We know that too many women and minority-owned businesses are unbanked or underbanked. And so what we have to do is incent banking institutions and lending institutions to provide opportunities for these establishments to thrive. And these establishments, these are folks who are filling out W-9s every year. They may have an employee or two, or they may have 5 or 10 employees. But what has to happen is that we have to make sure that the underbanked and the non-banked women and minority-owned businesses have access to those PPP dollars, and large lenders cannot exclude them from this process.
All right, I'm going to get to this last question here. I have about 20 seconds for each of you to answer this. HUD Secretary Dr. Ben Carson tweeted this week, the first round of coronavirus relief funds have now gone out to Indiana. That is $60 million to support local communities and nonprofits, our homeless citizens, and people living with compromised immune systems like HIV/AIDS. Is this enough? And if not, what are you going to be doing to work with HUD to get more support for Indiana? Representative Carson.
It's never enough. It's never enough, especially when you're talking about our homeless population, especially when you're talking about people who have underlying conditions, who have addictions, who are carriers of HIV/AIDS and other illnesses and diseases. It's never enough funding. What has to happen is that Congress has to make sure HUD has the resources it needs, but also beyond that, we have to make sure that the HUD secretary is being held accountable. If you have leadership of these agencies who view these people as being less than and aren't providing the money that we vote for, taxpayer dollars, to the places it needs to go, then you won't see the results manifest themselves. So we have to hold them accountable as our constituents hold us accountable.
All right. And quickly, Congresswoman Brooks.
Well, I'm going to respectfully disagree. I think Secretary Carson has tremendous respect for the people that are served through the HUD programs, and he has tremendous compassion for all of the programs in HUD. It's probably right. There's probably not enough funding, but that's because the needs around the country are so great. Homelessness has gone up dramatically, particularly in large urban areas. And we're very concerned about the issues with respect to COVID-19 in the homeless population specifically. I have talked with a number of managers of housing authorities throughout the state and throughout the district. Kim Townsend in Madison County does a great job of keeping me plugged in, and we know their needs are great in our housing community, and we need to make sure that we are providing those housing authorities with as much support as we can during this very difficult time. Yes. As they're trying to implement social distancing, as they're trying to make sure that their citizens are safe. But look forward to being a supporter of HUD and what they're trying to do.
Absolutely. We know this is a conversation that will continue indeed. Thank you both so much. Representatives Carson and Brooks will be back with us a little bit later this hour as we do continue our conversation with them. Dan and Birchell, over to you.
All right. Thank you both. This week, a coronavirus outbreak at a meat processing plant jumpstarts a conversation about whether we're doing enough to protect our food distribution chain.
We'll tackle this topic after the break. Plus, what role will the federal government play in supplying personal protective equipment for businesses? Stay with us.
It was, yeah. Hi there. Can you hear us, representatives up north?
Hello, hello.
Representatives Banks and Baird and Wilarski. Can you hear us?
Yes.
You can hear us. Hi, how are you all doing this evening? I'm Birchell.
Awesome. This is great, you guys. Thanks so much for doing it.
Well, we appreciate you all for joining us and
great.
giving an opportunity for Northern Indiana to speak to you directly and get some questions answered here this evening.
Absolutely.
So as you may have heard earlier when Fanchon was describing with our Central Indiana representatives there, we are a little bit tight on time. We got a lot of questions here from our viewers, so we want to make sure we can pack it all in. So we ask if you could be a bit brief with your answers, I should say. It would really help us kind of really get to many of the issues and concerns that your constituents have.
Great.
Welcome back to our coronavirus town hall. Thank you for staying with us. Now, we are joined tonight by Indiana's congressional delegation. You see them there. And we continue our conversation right now with representatives from Northern Indiana, Congresswoman Jackie Walorski and Congressman Jim Banks and Jim Baird. Thank you all for joining us this evening. We appreciate you being part of this conversation. You know, we want to start out first in Cass County, which ranks third for the most COVID cases in our state. Tuesday, local officials declared an emergency after the Tyson Foods processing plant in Logansport shut down. Now, hundreds of employees tested positive for COVID-19, and at one point, the local health department said they made up 75% of the county's cases. So, Congressman Baird, how responsible is Tyson Foods for this spread in your community, and what should happen next?
Well, interestingly enough, I've been working on with that community, and you should be very proud of the county commissioners, the county health department, and I had the opportunity to stop by after a greeting with the vice president at the plant and listen to the plans they have for trying to partially open the plant. So they're very concerned about the health of their employees. The other side of the coin is, from an agricultural standpoint, the livestock producers that have those 300-pound hogs that are ready to go to slaughter or go to harvest need to have that access to that plant. So I am very pleased to see that the county commissioners there in Cass County have designed a plan to be able to partially reopen the plant, and their local health department. And I've sat in that meeting with that group as they formulated those plans. And I think the local community should be reassured about the efforts they're making to make it a safe environment. And this is not only true across in Cass County, but the hog slaughter and our swine producers across the nation are facing a similar kind of problem. So the quicker we can get through it and get through this process, the better.
And Congressman, I know you just spoke specifically to what your county is doing, but to hold your feet to the fire there, so does Tyson hold any responsibility, yes or no?
Yes.
Okay, thank you.
I was just at that meeting I was at was in Cass County, and that was with the local commissioners and the local health department and Tyson representatives, and they were working well together to protect the employees.
And let's stick on this topic just a bit longer here. So we know experts warn that these plants, they may need to stay open to avoid a meat supply shortage. But our viewer Ann wants to know, why is the federal government only offering suggested safety measures instead of mandatory safety measures for these meat processing plants? Congresswoman, let's start with you on this one.
Well, it's a great question. And first of all, thanks. It's great to be with all of you today. Thanks for doing this. It's great to be with my colleagues. These are the types of questions that I hope we can get back to Washington and solve quickly when we get Congress back to work. And that's why conversations like this are important. It's important, though, that, as Congressman Baird said, that we rely on the leadership at the local level. We need our local health officials, our state health officials, and our federal health officials to work together to define what the new normal and the new social norms, the new precautions that we need to take as a society, as workers working in facilities all over the state of Indiana and all over the country need to take. That's what I'm looking for from our local health officials, who are the experts on the ground, to educate us on what those new social norms need to be so that we can get Indiana back to work. And that's what I'm focused on today, is being an advocate for exactly that. It's time to get Indiana back to work, but we need to do it with new precautions, new social norms, and we need our local health officials to work with the state and federal level to tell us what those will be.
And Congressman Banks, since we heard from you first, let's now see if we could hear from Congresswoman Walorski.
Yeah, I agree. You know, I can't say enough about what's happening at the local level and the state level. You know, I've had such a great opportunity to work and to advocate in my district for innumerable amounts of things with our task forces from the time I stepped back at home and flew back from DC here. You know, we've been at this thing together, whether it's advocating for PPE or it's looking to solve problems. You know, I have pork producers down there in that area of what you were just talking about with Tyson. And I can tell you that people in our states should be so proud of our local and state officials and how they've worked together. There has not been an issue that they've backed off from. Tough issues, we've all gotten into the mix on this to make sure that we are helping with that balance of making sure that we have safe places for people to work, and that we have, you know, that we're moving forward and we can see light at the end of the tunnel about actually getting back to work. So I can't say enough about our healthcare workers, who are our heroes, and inside of every single elected government, how everybody's been focused on one thing. And it's been, let's do this for our district. Let's do this for our state. We're going to win an invisible war, and we're going to do it together with Hoosier Common Sense. And you can see it every single day in this state.
Let's move now to the vice president's visit that Congressman Baird mentioned a bit earlier. He was here in Kokomo visiting the GM plant. Now, the Indiana DNC says, despite the VP's remarks, quote, the Trump administration's chaotic, erratic response has failed us at every level. So starting first in the 4th District here, Congressman, has the Trump administration met the needs of Hoosiers, and how?
Yes. And I think it's inspiring to see that companies like GM and Logan Sport and these other companies that have come forward And it's amazing to me, and it's the American spirit, the same kind of spirit we saw back in World War II, the same kind of spirit that I see in my fellow veterans, that spirit to meet the challenge and end up to win. And just as Representative Wazorski mentioned, we can win this pandemic.
Congresswoman, your thoughts on this? Has the Trump administration done enough?
Absolutely. You know what? When there was a need and we called out, we had resources. And it's not to say that we're not fighting like everybody else. We are. But I can tell you there's a benefit to be able to pick up the phone and call the vice president, the former governor of the state of Indiana, and have results. And I'll tell you, you know what? I think I am so inspired. Like Jim just said, I was at a company today in my district in northern Indiana making face shields. This is a manufacturing company that put themselves on hold, making auto parts to make face shields. And now they're making masks, which will be producing 80,000 a day. So when you talk about Hoosiers with ingenuity and crisis, breeding intervention, and those kinds of things, that's what we're seeing in our district and our state. And I'll tell you what, we've risen to the crisis. The president has absolutely risen to the crisis, and we are going to defeat this and celebrate at some point here on the other side. We're going to celebrate victory in this country like we haven't celebrated probably in my lifetime, because we did this together. We did not have politics enter the mix of this, and we can be so proud of our fellow Hoosiers. They're the ones that hunkered down, stayed home, didn't go anywhere. They're the ones that lowered the curve, so we can all be proud of the victory that we're going to see in the state of Indiana.
All right, I got a few seconds here left. I want to make sure that Congressman Banks gets to answer too. Do you agree with your colleagues up north?
Absolutely. President Trump has shown extraordinary leadership through all of this. He's criticized for literally everything that he does. He was criticized from the very beginning when he instituted the travel ban. He's criticized every day. But in spite of that, Hoosiers know that President Donald Trump has been a tremendous leader through some of the darkest times in American history. And I'm proud to stand with President Trump as we continue to get our efforts underway to get America back to work.
All right, well, we thank all of the representatives here for joining us. They'll be back in just a few minutes for a lightning round of questions, so stay tuned for that.
All right, Beershell, thank you so much. We do have more of your questions for our congressional representatives. That is still to come. Dan.
Will Americans get a second stimulus check? And should all essential workers get hazard pay? We'll tackle those issues with some of our reps from Southern Indiana after the break. Those notifications. Hello down south. Can you guys hear me? Congressman Pence.
I can hear you.
Congressman Bouchon, Congressman Hollingsworth, thank you so much for being on with us tonight. We really appreciate it.
You're welcome.
We'll be on here.
Happy to be here.
Yeah, thank you. We're in the commercial break right now. They can hear us, though, on the live stream on the web, but just wanted to say hello while we're in the commercial. Tight on time, obviously, as we move through this program. So if you're able to keep your responses to, in between 30 seconds or a minute, we'll also have time in our final round when everybody's on. But we'll try to get a couple of questions here in with each of you. And we'll have much more time on our digital portion at the end as well. Here we go. Welcome back to In Focus, a coronavirus town hall. We're broadcasting live tonight in 71 Indiana counties, bringing your questions directly to your representatives in Washington, D.C. And joining the conversation right now are Congressman Larry Bucshon, Trey Hollingsworth, and Greg Pence, who mainly represent different parts of southern Indiana and some parts of western and eastern Indiana as well. And let's get started with this question from Harry in Muncie, which is part of Representative Pence's district. He asks, being in a pandemic for about 6 weeks now, when is Congress going to give another stimulus check to help everyone? Because the first one, while nice, just, quote, put a Band-Aid on things, in Harry's words. Congressman Pence, can Hoosiers count on a second stimulus check in the future?
Well, thanks, Harry. Thanks, Dan, for having me here. You know, I would tell Harry one of the things he can do is get on my website, pence.house.gov, and kind of keep up with where the bills are, where the CARES Act, where the PPP, the PPE, what's going on out there. I had hoped that we would go back to Washington, D.C. and have a debate and discuss this very topic. But for some reason, the Democrats don't want us to go back. Now, we've got doctors, we have nurses, we have grocery store, C-store workers. Everyone's out there working, but I guess the House of Representatives doesn't have to go back and work and figure these things out.
The House physician this week citing some health concerns on that question. Jeffrey in Evansville has a question as well. He believes essential workers should get hazard pay, saying, quote, "We are daily putting our lives at risk with no protections." Congressman Bucshon, how do you respond to his concerns, and do you support hazard pay for all essential workers?
Well, first of all, I think many of your viewers know I was a healthcare provider before I was a physician and surgeon, and I'd like to thank all the healthcare providers out there who are doing what you said, risking their lives every day to take care of our fellow citizens. They should be applauded. I do think that we should have that debate. I think that citizens that are in the healthcare field, that are working every day, taking care of people, putting themselves at risk. I know one person in my district who has rented an apartment and doesn't go home because he's an ER physician and is afraid to spread coronavirus to his children and his family. So, yeah, I think this should be a consideration, and I think we need to get back to Washington, D.C. and have that debate on behalf of the people that we represent.
A debate you're willing to have, you say. Okay, Congressman Hollingsworth, this question is from one of your constituents who also happens to share your first name. Trey from Whiteland says the pandemic unemployment assistance program has been, in his words, a catastrophic failure. He says there's no one available to talk and the website continues to crash. Do you agree with his assessment, and how are you helping those who are in desperate need of this kind of assistance?
I'm so glad Trey asked, because I do agree with his assessment. This is what I hear from Hoosiers all the way across the district that continue to talk about websites crashing, the unavailability of Hoosiers to be able to get somebody on the phone, and the challenges in getting the payments and funds that the federal government has already put in place. There needs to be accountability here, because Hoosiers are counting on those funds to make ends meet week to week, not in weeks, not in months, but every single week. And we have got to do a better job here in the state of getting those funds out to those individuals who have lost their job.
Congressman Pence, this question comes from a viewer in Shelbyville named Mike, who says he called your congressional office about food shortages. He says farmers can't sell their produce and livestock and are in some cases destroying it to cut their losses. What's your strategy to deal with this possible food production and distribution crisis?
Yeah, Mike, thanks for the question. Thanks, Dan. I actually sent a letter to Sunny Purdue today asking them to get on top of this, not just for livestock, but for tomatoes, other crops, fruit and vegetable crops. This is a big deal. As the economy has contracted, as people have stayed home, as the supply chain has been disrupted, going from people eating out to different portions back to the grocery store, the system doesn't have the capacity to make this conversion as quickly as it needs to. We're working, we're bringing all the information from farmers in our district, and we're sharing that with the administration.
Another question from our viewer here who works at Tropicana Casino in Evansville and is wondering what the timeline might be to reopen casinos and what precautions would be recommended when the time comes. I know a lot of you have casinos in your district. Congressman Bucshon, how concerned are you about the impact this will have on our state's casino industry?
Well, it's going to have a dramatic impact, as it already has, based on what we've seen with the needs for social distancing and to protect our fellow citizens. The administration in D.C. released a 3-step guidelines to get people back to work and get people back in their jobs, and that would include at casinos. I also think that Governor Holcomb and his administration has done a good job at the state level, and I'm going to rely on the medical data on whether it's safe or not to reopen these type of facilities, and that has to come from Dr. Box at the state level, Dr. Fauci and Birx at the national level, and then with the guidelines put in place at the national level through the governor's office. So there's no good answer to the question. It's a very difficult problem to solve, but I'm hopeful that we can soon get these type of places open back up. But the medical reality is right now, I don't think we're quite there.
On this broader topic of reopening, Congressman Hollingsworth, you faced some controversy recently over your remarks on the economic concerns versus the health concerns. We talked about that recently on In Focus, but we're also talking about these protests. There's another protest scheduled tomorrow at the State House with protesters who want the economy opened up, and a pretty intense protest today in Michigan as well. I want to ask you, do you agree with Governor Holcomb when he says these protests, because people are closely gathered and some not in masks, that these protests aren't helping the situation when it comes to social distancing and the guidelines that are in place?
I want every Hoosier to be safe. I want everybody that is out protesting to ensure that they are socially distant, to ensure that they're wearing masks. But ultimately, the reason they're protesting is because of the unprecedented restriction on their freedom, the unprecedented restriction on their ability to earn income for their families, the unprecedented restriction on their religious freedoms. And Hoosiers all the way across the district, all the way across the state are starting to say, I want to get back to work. I want to educate my kids. I want to go back to church. I can do those things safely. I will find a way to do those things safely, but they expect to get back to their way of life as quickly as possible, provided that we take all the safety precautions along the way. I think it is hugely important that we listen to Americans who are saying that they want to find a way forward, no matter how difficult the circumstances, no matter how many precautions we take, find a way forward to create their way of life again.
That reopening debate continues, especially in districts like yours that all share a border with a neighboring state. Governor Holcomb has entered into a regional grouping of Midwestern governors to better coordinate that response. How important is it specifically for these regions and counties along the border to have that kind of coordination with neighboring states? Congressman Pence, quickly, I'll leave this one to you.
Yeah, my district is adjacent to Cincinnati. You know, we don't want to have completely different plans rolling out where one group may go across the border and overwhelm the cities adjacent to, and I think it's a good idea. And by the way, the governor's done a great job. I think talking to the other states, bringing everybody together to discuss the best way to approach this. I'm really proud of him, as I am very, very proud of my brother, the job he's done on the task force.
All right, Congressman Pence, Congressman Bouchon, Congressman Hollingsworth, thank you all for being here. Much more to come with you and our other representatives coming up. Guys.
Thank you so much. Our conversation with U.S. lawmakers continues right after this break.
Up next, we are putting our representatives in Congress through a lightning round to get their takes on protests, wearing masks in public, and reopening schools.
All right, welcome back to our coronavirus town hall as we broadcast live across Indiana tonight. We continue our conversation now with Indiana's congressional representatives.
Yeah, it is time for our lightning round. We're going to speed things up a little bit here with our representatives. We're going to ask you to answer these questions with a show of hands.
So raise your hand here if you think that we are ready for the governor to reopen the state's economy tomorrow, at least parts of it.
A number of you think so. Congressman Carson, not so sure yet.
Well, you know, I think Governor Holcomb is a good man. I actually like him. We have a great relationship. He's a Pike graduate. I think I want to hear from the Dr. Kanes first in the world and the health officials. That's something we're trying to work through, even as an intelligence committee, of collaborating with health officials before we make these decisions. I know he has a great array of advisors with him, but I'd like to get more public assurance and reassurance from health professionals.
All right, so you think we still need to wait. Our next question, how many of you think we need to make that decision maybe region by region? Show of hands.
Just about, yeah,
just about everyone. The same?
Yeah.
Okay.
All right, next question up too is, what about these masks? Should people be required to be wearing them in public? Raise your hands if you think they should.
You're thinking about it, Congresswoman Brooks. Congressman Carson thinks
Thought about
we
it
should.
too, though.
You know, I think that the medical professionals have been all over the place on this. And so I would love for the medical professionals to tell us, certainly if you might be sick or have been sick, you ought to be wearing it. But I think there's no question as if you are not sick at all and have no symptoms, even though this disease has asymptomatic for a couple of weeks. We've been told there aren't enough and that it might not help that much.
Right.
But I believe in gloves.
We've got to leave it there for now. Thank you so much.
And make sure you do stick around with us. We have a few more questions for our lawmakers. You can see more with all of us on fox59.com and CBS4Indy.com here in Indianapolis and across the state on your local station's website.
Thanks again to all our representatives for taking part and to you, our viewers, for sending in so many great questions. We appreciate it. We hope you're doing well.
We'll see you online. Have a great night.
Have a good evening, everyone. Thank you so much.
Thanks. Okay.
I think we signed.
All right, everybody. We are online, digital. I think we're ready to go for more questions here in our virtual town hall. Our thanks to our lawmakers. Sincere thanks for everyone taking part in this, both our viewers and our lawmakers and all of the teams here at Fox 59, CBS 4, and our stations across the state. Welcome back. Our special In Focus Coronavirus Town Hall continues now with more questions in our virtual town hall as we continue now online.
That's right. A number of our representatives, as you can see, are still with us for more questions from our viewers. Again, I want to say thank you to all of you for being here with us for this extended time. And for our viewers, thank you for sending in so many great questions.
Yeah, hundreds. Yeah.
So let's kick it off here with some questions that we were not able to get on our on broadcast portion here. Anne in Westfield has this question. She wants to know, what have you learned over the past few months and what changes should be made to better prepare us in the future as a household, a community, state, and country? So who wants to take that one first?
Congresswoman Wilarski.
Thank you. I have learned so much because I've been here advocating at the local level and seeing what hospitals have gone through, seeing what the stockpile has been like, the constant hunt for PPE, advocating to the private sector. I have learned that I think one of the things we'll take away with, if I ever get to do a debrief on this, is to say that hospitals, public health facilities, nursing homes, EMS, all the emergency resource coordinators we've got to begin our own stockpiles and not lean on the federal government for all the answers. You know, I think that when this is all said and done, what we're going to find out is public-private partnerships are going to be a key to our healthcare in the future. And I think telehealth is an absolute winner. And I think that's one of the great things we'll see in healthcare is how telehealth has been set up and how it accesses so many people for such an unbelievably low cost. But I think also when it comes to supplies, we're going to do this on our own better.
Congressman Bouchon, I want to ask you too what you've learned. You, like you said, have a medical background, so you already know a lot about medicine. But this is the kind of thing every doctor who's been around for years and years in the medical field is learning something new every day about this virus because it is new. What have you learned?
Well, let me first of all say that I've learned that we have a resilient workforce in the healthcare space. I've been very impressed with what my hospitals, both in Evansville and throughout the rural areas of my district, have been able to do in a very short order, really, on their own, and the public health departments. But the big picture is, at the national level and at the state level, we were not really prepared for this type of a pandemic. Even though for decades we've been talking about this in Washington. President Bush gave a speech back in 2005 talking about this. We weren't prepared, and I think we need to really have a top to bottom review of our public health system, the interconnectivity between the counties, the state, and the federal government, and look at our stockpiles, what is reasonable to have available, and then make that assessment. And I think it's going to take us a while to make that assessment. And we need to do it in a logical, stepwise fashion so that we don't overreact and do things that cost the taxpayers a lot of money for no reason. But we want to be better prepared.
I kind of want to stick with this topic. Congresswoman Brooks, I know you have worked with global medical response and global medical security. I want to find out what you think we need to do going forward, and then also to Representative Greg Pence, in terms of a lot of people, the more we learn about China and where this has started, a lot of people are angry and wanting to know if China is going to be held responsible for what has happened.
When it comes to global, I think what people are now realizing is that global health, an issue that can happen across the globe, can be in our country and can impact our country and other countries around the globe within a day because of air travel, and that people can transmit. And that's the importance of countries cooperating at an international level and making sure they are informing the rest of the world when they see something that is happening. And that is what some of the physicians in China tried to do. But then we saw that the Chinese government really ensured that that information did not get out at the time that it should have gotten out back in January, as early as they were seeing it spreading. I think we also know that we have to do a better job working. The medical community and researchers have often worked together, and we've got to make sure that collaboration on therapeutics and vaccines and diagnostics is just working at the closest level possible. So I do think we have to make sure that our medical community, our researchers, our NIH, and everyone is working as closely as possible with the researchers around the globe.
All right, thank you for that. And Representative Pence, accountability.
Yeah, I think that's a great question. I appreciate that question, but right now isn't the time to affix the blame. The time right now is to fix the problem, and it's health and safety first. But on beyond that note, I get increasing calls from my constituents about what are we going to do about what the Chinese government has done to us in the supply chain, beyond just the medical, the medicine, and other things. And I think that's a conversation and a dialogue that will be had when we get back to Washington, D.C.
And I want to give the final two here a chance to weigh in on this conversation as well. So Congressman Hollingsworth and Carson, kind of combining these questions here about the future and our relationship even with China. What do we do moving forward when we talk about coronavirus and public health, a pandemic like this?
Well, I know from my perspective, one of the things I've been focused on since taking office was ensuring that we held China accountable for playing by the same rules as the rest of the world. China has long taken advantage of the United States from an economic standpoint, stealing intellectual property, using the World Trade Organization to get more manufacturing in China and out of the United States. I believe, first and foremost, if you are going to be and compete in our developed world economy, then you have to play by the same rules. And I think that we should strictly and fully enforce those rules on China for what they have done with regard to this virus, but also the economic advantage that they have taken over the United States for the past 2 decades.
And Congressman Carson.
Sure. I think we have to robustly fund our public health departments and medical research. We can't cut the CDC or NIH's budgets. We have to provide more support for international health organizations like the World Health Organization. I think we have to do things that are focused on preventing the spread of infectious diseases globally, but we also have to have some kind of symposium, public symposium, a public forum with public health officials and intel officials coming together about ways in which we can prevent the next pandemic and even biowarfare coming from places like China.
All right, our next question here comes from Michael in Indianapolis, who wants to know, how are you working in a bipartisan manner to try and remove politics from the equation and focus on results for Hoosiers? Congresswoman Brooks, I'll start with you.
Actually, tomorrow I'll be participating in what's called the Bipartisan Select Committee on Modernization of Congress. And while we were doing our work, I think what this pandemic has shown us is that Congress has been behind the curve, the House of Representatives and the U.S. Senate, when it comes to technology. And we're going to be having a very robust discussion tomorrow about the issues of technology. Here, we're all participating in this forum
right.
With Fox.
Bipartisan right here. Yeah.
In a whole new way. And so how can we conduct the people's business in part, through technology, whether it's Zoom or other means. And so we are trying to come together and continue to figure out how to get the people's work done together. Some of it will require us to be together, to even change those rules. We got to come together. And we're working on legislation together. We're signing on to bipartisan letters. We're signing on to each other's legislation that we're writing. I'm in the middle of proposing some legislation with other members, and they're always, they're across the aisle. And so that's how we're working together.
How many of you think Washington is a more bipartisan place right now than it is typically, in a show of hands? Some of you think so? Maybe?
5 out of 6 more. Yeah. Oh, 6
yeah,
out of 6 here.
6 out of 6.
It took a little while, but 6 out of 6.
That's encouraging, actually.
5.5 out of 6, maybe.
We have another question now from Amy. Amy's from Avon. She wants to know, if the stay-at-home order is lifted prior to the end of the school year, how are working parents supposed to handle going back to work with their children doing e-learning, since places like the YMCA are still not providing childcare? Might there be extra protections for workers who find themselves in that situation? I'll just throw that out there. Whoever wants to respond to that, go ahead.
Well, I would certainly hope that when that happens, that we have some kind of at least a connected rollout. Doesn't have to be fast, can be slow, can be very, systematic and very pragmatic. But I would hope that those kinds of facilities are going to be linked in to any question we have about school and about parents working. I'm hoping those facilities are going to be linked in there, that they will be up and running and allowed to stay, different precautions and those kinds of things. But otherwise, we're going to be back in this situation where we're still going to have people on unemployment when their places have opened and they have no childcare. So that's going to be a continuing process, but I do hope there's a connectivity to the release of those companies at the same time.
Congressman
else?
Pitts,
What-
yeah, you raised your hand there.
Yeah, I hope we see employers help people through that. I don't think when we start back up, we're going to start at 100% and get back where we were before. And I think as my wife has a business, as an employer, business person for all my life, you know, it'd be my responsibility to help take care of my employees and the problems that they have. And you know, one of the things, the first question was, one of the things I'm going to take away from this is, you know, I'm just proud to be a Hoosier. It's phenomenal what we've done here in Indiana, and the calls I've got, watching people step up to the plate and help other people. So I would hope that businesses would help people through this.
Any of your other Congress members have anything to add on that one?
Congresswoman Brooks?
I actually heard from our Carmel Parks Department, because a lot of people don't fully appreciate that often it is parks departments that have summer programming for kids.
Right.
And so that's one of, I know my kids, you know, went to the Eagle Creek Park camps back when they were little, and it really helped me as a working mom. And so these are city functions that I think we do need to think about. They often provide childcare opportunities. And so it's really important for us to help our local governments figure out how to open some of those up also.
Some of those are still in flux as they wait to hear what the governor decides to do on the stay-at-home orders.
Well, let's move into a different question here. This one's from Steve out in Indy. He asks, did the legal requirements for requesting PPP funds allow publicly traded companies, hedge funds, to receive PPP funds, and also allow large entities to submit many small requests? If so, do you believe that this is a mistake? Let's start with Representative Hollingsworth.
It's a great question. There were rules in the program of affiliation that would minimize companies that were subsidiaries of larger entities or otherwise affiliated with larger entities by ownership in hedge funds, by ownership in venture capital, to try to prohibit those type of firms from getting the funding so that more and more small businesses could get the funding. I think it's important to remember that the average loan size in this program was less than $150,000. And certainly the very large loans, which many public companies have paid back now, made the headlines, but many, 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 many small businesses were able to receive these loans to help get them through this difficult time, get back to opening their doors and hiring their employees back.
The Los Angeles Lakers, one of the teams that got money from all of this. Congressman Carson, what are your thoughts on this issue?
Well, I think it's important that we not make the mistake that we made over a decade ago during the economic crisis and downturn, where we saw Wall Street benefit, but Main Street suffer. And one of the things that we're trying to do and correct with CARES 2.0 or C5, however you want to call it, is to ensure that large lenders are prioritizing those smaller businesses and entities and are offering access to capital. So it was not Congress's intent, but that seems to be the case. And so, which is why I'm for a clean bill on supporting municipalities and states. But if we're going to deal with businesses who are the backbone of our economy, we have to make sure that the mom and pop shops are protected as well, especially our restaurants, which brings me to the point. I'm going to stop my camera briefly because I have to break my fast before I pass out on camera. So
we do not want that.
No, thank you very much.
We don't want that at all. Well, let's see if we could hear from Congressman Bouchon. I see you put your hand up there.
Yeah, I mean, I just want to say, you know, the unprecedented speed with which the Congress acted to create this program, and then honestly, the onus that we put on Treasury and the Small Business Administration to quickly administer it wasn't perfect. I think everyone recognizes that. And in defense of the Department of Treasury and the Small Business Administration, I think they've done a tremendous job in doing what they can to make sure that the appropriate businesses got these loans. And of course, we found out that there were some businesses like the LA Lakers, for example, that did get the money, but they've returned it. And some universities also that have large endowments. But you know, the unprecedented speed with which Congress acted in a bipartisan way and the onus we put on these federal agencies was tremendous. So honestly, I have been pleasantly surprised about the small amount of errors that have been made, but there certainly have been some. And I think those have been corrected, and I think all of us would recognize that they needed to be.
Anyone else? Representative Wolodarski?
Thanks. You know, I sit on the Ways and Means Committee, and I'm honored to do that. And we've been very involved, obviously, in this whole rollout with Secretary Mnuchin. So at least twice a week since this started, and since the whole process of the PPP and the EDIL and all those loans rolled out, I'll tell you what, from the time they rolled out, there's been a massive evolution over the last couple of weeks. And the evolution has been that as we're back in our districts and we're hearing from local folks that are trying to access those loans, we made, and the secretary made, unbelievable parameter changes to make it easier, make it less bumpy, to hone in those parameters so there weren't, you know, those kind of loans going out to Ruth Chris and the Lakers and those kinds of things. And I'll tell you what, so many Hoosiers, that is such a popular program, the PPP, because it's forgivable. So many Hoosiers have been able to hold their companies together and keep their employees from going on unemployment because of those programs. And I can't say enough about Secretary Mnuchin and the Trump administration. They listened when we talked to them and said, you have to change these, and they did. So I'm very optimistic about the future of the program as well.
Well, we know that small businesses are about 99% of our economy in this country, so that is encouraging to hear.
And another question here from Marjorie for Congressman Hollingsworth. Speaking of business, she said she'd be curious to hear your business perspective on how our country can work to get back to the thriving economy we had before COVID-19. How long do you think that will take? Which businesses will bounce back fastest, and which will take longer to recover?
Oh, Marjorie, I wish I had that crystal ball to be able to give you the exact pathway and which industries, which businesses are going to bounce back first. What I would say, Marjorie, is that we will get through this. We will bounce back. And I can promise you, Republicans, Democrats, senators, members of Congress, and the administration are all going to be focused on how we rebuild the great economy that we had just 6 weeks ago. It is important to remember the number of people that we were able to get employed that were previously unemployed. We're able to get off food stamps, and we're able to start small businesses in the last 3 years. We want to get back there, and we know that we can get back there with the right leadership, the right support, and frankly, the ingenuity of the American people to resolve their way through this and out-innovate the rest of the world. And so I'm excited to be a part of how we rebuild this country's economy. I know everybody's excited to see those results, and we are going to work on that as we start to open up the economy to get back to the economy that you want.
We have another question here, but before we go to that question, does anyone else want to expand on that? No? Okay.
Amen.
I'm sorry?
Amen.
Amen. All right.
Okay.
I think that's a second.
Yes.
There we go, Greg.
Well said.
Yes, Andrea Hudson from Carmel asked this: with such a high percentage of COVID deaths occurring in nursing homes, why isn't more help being rushed to nursing homes and other long-term care facilities? Now, with that question being said, we know the president today just announced a special counsel to put in place more protections for our senior citizens. So what can we do locally, though, here to work alongside that? Anyone? Yes, Representative Bouchon?
Yeah, I mean, as I've said, you know, I was a healthcare provider before, and we know that this virus is particularly dangerous for elderly patients who have a lot of comorbid medical problems. Those patients are many are in nursing homes and assisted living, and so it's a very difficult to make that assessment leading in. We really didn't know. We saw what happened in Washington State, and I think everybody tried to get out ahead of that by stopping visitation to these facilities for families and others, and also to institute policies more quickly there to try to protect these high-risk citizens. But the reality is this coronavirus is very damaging and very dangerous for people with comorbid conditions. If you look in New York City, the deaths that they had, 70 or 80% had other health-related problems, and we know that that nursing homes and assisted living, they're all high risk. So We can do more and we should do more, but it's a very difficult population medically to protect, and we're doing, I think, better and doing the best that we can.
Anyone else? Yes,
Sure.
Representative Brooks.
I think that this pandemic is actually shining a light on a challenge that a lot of our senior living communities, nursing homes have, and that is on the staffing. And we have been told for a very, very long time that nursing homes in particular really have a difficult time making sure they have enough staff. And we really do have a nursing shortage in this country. And so all of the people who are working, I want to commend the people who are working, going in and day out and working in senior living communities. It's incredibly difficult work. And it's not the type of work that a lot of people raise their hands and go and work in senior living communities. And yet it's so rewarding. And those people are working incredibly hard right now. I know that CMS also, when this all started, made sure that infection control was the top priority in nursing homes. And that is what they're very focused on, as is our state health department. We've needed to make sure that our senior living communities have sufficient personal protective gear, PPE, and we know that that wasn't the case when we started out. Our stockpile at the national level, as well as whatever the state had and what nursing homes had, they did not have enough in order to move through PPE in the way in which they needed to move through it. A lot of testing now. I want to commend Lily for providing testing for healthcare workers who work in long-term care facilities. But we've got to make sure there's that cooperation also between local governments, those first responders who are going to those long-term care facilities. They need to be very upfront with what is happening in their local, in their long-term care facilities with local officials, so that those local officials, as they're sending fire and EMS in to help them or to possibly move them to hospitals, that there is that coordination and that information flow. So we've got a really big challenge in long-term care all across the country, not just in Indiana.
And a number of your districts,
but I will tell you though that the people, the family members are really struggling, who cannot see their family members. And so they've got to make sure they're keeping in close touch and doing everything they can. But I hope that nursing homes become as transparent as possible with not only those inside the nursing homes, but with the family members outside. I'm hearing that from constituents.
Well,
thank you, Ashley, for the question.
As you speak about that with the transparency, I do want to bring one other question that has been certainly a big topic here for us at Fox 59 as we go into these, state coronavirus task force. The question of whether or not these nursing homes that do have coronavirus cases, whether it be suspected cases or deaths or actual positive cases, whether or not they should be releasing that to the public. Should we know the name of the facilities that have coronavirus where we have our senior citizens?
Who thinks the government should provide that kind of information to the public? Show of hands. Just about all of you. Yeah.
I would imagine that's going to be a conversation going forward in terms of making sure that happens. Something a number of
states are doing.
Exactly. Yeah.
All right, let's turn now to a question in Whitestown from Erin. She wants to know this from you all. She asked this question: what are you doing to ensure that the second round of funding for the PPP actually reaches small businesses? So let's start here with Representative Pence.
Yeah.
That's about all we do. I have 14 staffers. We've handled over 1,000 calls, about 6,000 emails. We're doing everything we can, working with small banks and credit unions and helping people understand how they apply. So that's something we're doing every single day.
Okay.
And I know I saw that Congresswoman Walorski, you had your hand up there too for that question.
Yeah, and again, so having the access that our Ways and Means Committee has had with Secretary Mnuchin, one of the things that we have really hammered on behalf of small business and small banks is the need for these portals where these loans are applied through and banks access, We actually had a consistent problem with smaller banks not being able to be a part of that. So yesterday from 4 p.m. till midnight, the portal was closed nationwide to large banks, opened up only to very, very small banks and small communities. And again, trying to make sure that we're pushing that money down as far as we can into small banks and small business. And we did that as a result of listening to what was happening in our districts, needing to make federal changes to affect the district level, and we did.
Well, thank you all again for
Yes.
taking a big chunk of time tonight to talk with us and to answer so many questions
Yes.
from our viewers. So many great questions. We really appreciate your time and for being with us here this evening. Thank you, one and all, for taking this opportunity to gather all in one place virtually and in a bipartisan fashion.
And thank you for serving our country and our state like all of you do. We so appreciate it. God bless.
Thank you. Thank you so much. We do appreciate it. Stay safe, stay healthy. We also spoke earlier with Senator Todd Young. We have more of that interview we showed you earlier during our hour-long broadcast. Here's more of that conversation now from earlier today.
There was a poll out this week, though, from Marist, whether it's a good idea to reopen, whether it's a good idea to reopen schools. 85% said that's a bad idea without further testing. To dine in a restaurant, 80% of people thought that was a bad idea without further testing. 65% said a bad idea to return to work without further testing. Are the American people ready for the country to reopen? And certainly we understand that probably depends on your perspective, whether you're worried about getting sick or whether you're out of work. It depends on your perspective. But do you think the American people are ready?
Well, there's a certain reasonableness to people's varying perspective depending upon where they live. If they live in a densely concentrated area with more cases of COVID-19, I, of course, would be more apprehensive about going out to a restaurant in one of those geographies or going back to work. But if instead you live in a rural area where there are very few cases of COVID-19, where few people appear to be symptomatic, then I think you have every reason to feel more confident. And so that's why you see varying approaches across the country and even within states, in certain states, to the protocols that are in place in terms of going back to work and resuming some semblance of normalcy.
Okay. Couple more questions here from our viewers. Andrea Hudson from Carmel asks, with such a high percentage of COVID deaths occurring in nursing homes, why isn't more help in terms of PPE or testing being rushed to nursing homes and other long-term care facilities?
Well, Andrea, it's an excellent question. I do think that the governor and public health officials are making every effort to prioritize where they send a limited supply of PPE. So we want to make sure that our healthcare workers, those heroes of this entire enterprise, are protected and feel safe, helping out our fellow Americans. And we also want to make sure that the residents who aren't infected currently by COVID-19 in those facilities are also safe. So I do think it's been made a priority, but to the extent more of these PPE can be procured or produced, I think they need to be shipped to these higher priority areas.
Another protest at the State House this past week. We've seen demonstrations across the country with protesters calling to reopen the economy. Viewer Susan asks, do these protests bear any weight with you? How do you balance some people's eagerness to get back to normal with what the numbers of cases and hospitalizations are showing?
Well, the fact that they're protesters per se doesn't bear specific weight for me, but I listen to every Hoosier. I mean, I really try and solicit feedback and viewpoints from every corner of the state and from every perspective. And so, yes, I value the opinions of those who speak with a loud voice and those who send a polite email to our office. So I welcome the feedback personally, and my expectation is that all of our government officials to the highest level also welcome that extra